Hey everyone, I'm Dr. Matt Najad, and today I'm excited to talk to you about toothbrushing. We're going to cover everything from the different types of brushes, including manual versus electric, and we're going to be covering tips and tricks, technique, and what to do to prevent cavities and have healthy gums. So I hope you're ready. Let's get started. So first off, let's talk about manual versus electric toothbrushes. And I already know what you're thinking. Electric toothbrushes are better, right? Well, that's what everybody tells you. If you read about it online, that's what you're gonna find, but I totally disagree. I use a manual brush, a soft bristle brush, and I'm gonna review that in a minute. And this brush, I think, cleans better than any electric toothbrush out there if you do the proper technique and spend the right amount of time. So what's the problem? A lot of people cut corners, don't spend the time, and they need an electric toothbrush in order to do a satisfactory job. But if you do the technique that I'm going to show you and you spend the right amount of time, I firmly believe you're going to get the best possible clean. And I'm not the only one who thinks that, because a lot of professionals and all my patients agree. We love using a manual brush with this technique. So when it comes to manual brushes, there's so many different options for the types of bristles. You can get hard, medium, soft, and even extra soft or sensitive bristles. So which one do you choose? Well, that answer is very easy. You want to use soft or extra soft bristles all the time. There's no advantage to using medium or hard bristles. And in fact, they're gonna cause irritation to your gums and lead to gum recession and problems for a lot of patients. So we never recommend that. You can do a perfectly good job using the sensitive, soft, extra soft, and that's what I always recommend to all my patients. So the type of brush you want has to be effective at cleaning near the gum line, and it has to have soft bristles. So what do I recommend? The Nimbus toothbrush. It's perfectly designed with extra soft bristles, and it has a second set of longer bristles that are designed to go under the gum line to clean out plaque and massage the gums.
Regarding the brush, there are three options to choose from. There's the regular head brush, which has a traditional size brush head with those microfine extra soft bristles, and this is perfect for most people. That's what I use. Then there's the compact head brush. It also has the same bristles, but it includes a slightly slimmer brush head. So this is great for kids with smaller mouths, including younger kids and teens. And then there's the Nimbus, which is a children's size toothbrush. It has a smaller handle for easier gripping, and it also has a mid-size brush head. This is for young kids up to around 10 or 11, but it's also a perfect travel size toothbrush for adults, and that's what I take with me when I'm on a trip.
I've been using this brush for the past 10 years, and my tip to you is to start using this immediately because it's super effective, it's not expensive, and it's gonna do the best job cleaning if you use it in the right way. We're gonna cover that next. So how do you brush properly with the Nimbus brush? Very easy. You wanna take the brush and hold it at 45 degrees, pointing towards your gum. Then you wanna go ahead and do little gentle circles, and what you're gonna do as this happens is make the bristles go under the gum line, which is gonna sweep out the plaque, and also it's gonna massage the gums, which enhances circulation. It's gonna be gentle on your gums, and it's gonna remove anything that leads to periodontal disease and gingivitis. So this is the perfect technique, and anywhere you brush, you're gonna wanna make sure you're adapting that technique. Don't forget to brush all the different surfaces of the teeth, including the chewing surface and the inside surfaces. In this demonstration here, you can see how the back of the front teeth on the top and bottom are gonna require you to hold the brush a little bit differently. And it's important as you do this to always imagine that the bristles are gonna sweep under the gum line.
Brushing the chewing surfaces of the back teeth is the only time you can use a scrubbing action to effectively clean food and plaque from inside the grooves.
Other areas of your teeth are so easy to keep clean. Smooth surfaces are usually not going to have major problems, and you're going to be able to keep it clean with this technique anyway. And then for in between the teeth, remember, you always need to floss. There is no substitute for that, but this brush will sweep away food near the gum line between the teeth. Let's summarize everything we've covered in this video. First of all, a manual brush is equally effective to an electric toothbrush if you use the right technique and the right brush. The right brush is going to have extra soft bristles that are not going to cause any irritation to your gum, and the area that you need to focus on with your technique is the area near your gum line where plaque accumulates. If you use the right technique and the right brush, you're going to avoid all sorts of problems. And the best brush, in my opinion, is the Nimbus brush if you can commit to spending the time to use it properly, and that's the key. If you know you're not going to do that, then maybe an electric brush is the best for you. But if you want the absolute best professional results, I recommend you give the Nimbus brush a try.
Another important tip to maintain optimal oral hygiene is the regular replacement of your toothbrush. I recommend doing this once a month. To achieve optimal cleaning, your toothbrush's bristles need to be in excellent condition. They wear down quicker than you think, and you can easily notice the effectiveness goes down significantly. Additionally, replacing your toothbrush more frequently is not only a matter of efficacy, but also for sanitary and hygienic benefits. Brushes accumulate bacteria over time and become highly contaminated after 12 weeks. A fresh brush, free from bacterial contamination every month, is a small investment that can make a big difference for your dental health. They should ideally be replaced every month, 3 months at the absolute latest, to minimize risk of infection.
Before we finish, I have one last request for you. If you like this video and you want to keep seeing other great content that I'm working on, please support my channel. Make sure you like this video, you subscribe, and hit the bell for notifications. Thank you for watching. I really appreciate you.